Talking health care.
Aaron O'Toole, his instincts, his values are not aligned with helping vulnerable Canadians.
Government accountability.
Mr. Trudeau has a problem with entitlement. Right from the beginning, he thinks being Prime Minister is about himself.
And the crisis in Afghanistan.
Maybe the fact that Justin Trudeau called an election might have impacted his ability to plan for the evacuation of our allies.
Canada's party leaders attacked each other Sunday as they bounced from issue to issue to close out week one of the campaign. Jagmeet Singh kicked off the day in Toronto to pay tribute to NDP leader Jack Layton on the 10th anniversary of his death. Layton led the party to a historic result in the 2011 election.
I didn't really believe that politicians can make a difference. And my friends pointed to Jack and said, well, what about Jack? Don't you think he's someone that makes a difference? And I got to be honest, I was pretty cynical, but Jack was able to overcome the cynic in me.
But there was still plenty of cynicism on the campaign trail. At a stop in New Brunswick, Liberal leader Justin Trudeau brought up past comments made by his Conservative counterpart about a two-tier healthcare system.
Aaron O'Toole, in the pandemic, came out clearly in favor of a private, for-profit healthcare system for Canada. Shame on you.
I 100% support our publicly funded and universal healthcare system.
On the other side of the country, Aaron O'Toole promised a Conservative government will invest in healthcare, including new drug treatment beds and Indigenous-centered mental health and drug treatment programs.
We need to make sure our public system is strong, and we're making the investments to guarantee that.
Meanwhile, Singh accused the Trudeau government of implementing a complicated paperwork process for those wanting out of Afghanistan.
It was bureaucratic, and we've got an imminent humanitarian crisis. That is not the way to respond.
Caryn Ceolin, City News.